Welcome to Jeevan Jyoti Institute of Medical Sciences, serving you medical comfort. Vaisach Vritya Sukhad.
Hello and welcome. I'm Jyoti Singh from Intellico Research and Services, and today with us we have someone who doesn't need any introduction. Today with us we have Dr. Monika Deb, who is one of the most renowned gynecologists of Barak Valley and has been practicing for over 2 decades now. Welcome, ma'am.
Ma'am, first of all, tell us something about your journey as a doctor.
If you are really asked me about being a doctor, when I was in 5th standard, we had been given to write an essay on aim in life. That particular day, I wrote my aim to be as a doctor, even though I had no idea what doctor does, thoda bahut, but nothing so much. So when I got a correction made, I usually has to come back home and show my father. So my father said, you wrote it this way, can you become? So then I was always that type when I was young, ki nahi karna hai. Since when my father had asked me, so I said, yeah, I will do it. He said, how? I said, okay, let's see. From that particular day, I had a feeling that yes, since I've written as my aim in life, I should see that I try and become a doctor.
That's very inspirational, ma'am. I'll be asking you some questions today, which every girl or woman of any age would want to know from a gynecologist. So my first question is whether premenstrual syndrome, which is PMS, is real, and tell us something about maintaining a sound menstrual hygiene.
Regarding premenstrual syndrome, yes, 3 out of 4 women, it is said, experiences this once or twice or thrice in a lifetime. The thing is that premenstrual syndrome is actually, if you consider a very young age, a girl getting at a very young age, first of all, the fear of it might cause us some symptoms in her, because the premenstrual symptoms doesn't come in in a one symptom. There are plenty of symptoms or signs which might occur in a female. Secondly, when a girl is in, say, supposing it is in tension or some psychological disturbances there, she might experience premenstrual symptom. This premenstrual symptom usually goes off as the girl grows up, gradually goes up and tries to know the problem, what happens exactly. Supposing she doesn't have any other abnormality in her, then this gradually grows up once she's married or she gives birth to a child. Now, premenstrual symptoms and signs, there are 2 things. Symptoms, there can be behavioral change, there can be depression, there can be fatigue, there can be abnormality and decreased appetite, there can be decreased sleep, whatever. But when we come to signs, yes, maximum girls, they get acne prior to menstruation. This is nothing. When a girl comes to us, we just usually try to explain that this falls under premenstrual syndrome. So, and this gradually, it vanishes after she gets her periods. And once she grows gradually, when her age increases, the acne part usually vanishes off. Secondly, in case of, we say diarrhea, maximum girls, they come with a history of giving us complaints of diarrhea. This is nothing because premenstrual syndrome, one of the most common is the spasm, cramps. So when the uterus contracts because of extra prostaglandin secreted, that I won't explain because you don't understand also. So because of that contraction, there's vasculature contraction also. This vasculature contraction decreases the blood circulation to the endometrial lining. There is release of those whatever the lining collects all throughout they die off and they get released. So this particular cramps can cause pain. Indirectly, because the uterus is a smooth muscle, the smooth muscle is contracting. Same way, any smooth muscles in the body can contract. So the patient usually complains of pain in the inner thighs, lower abdomen. There can be diarrhea. So these are few signs also we get in females. Then weight gain. Usually you feel heavy before periods. So this is actually before menstruation. There is fluid retention in the body sometimes. This causes a bit of weight gain that again vanishes off. But premenstrual symptom, it happens usually after period and goes off. So nothing to panic about. We say the girls don't panic. This is very natural, and this with due time it gradually. Actually, we get habituated. It's going on, and then girls try to understand. They don't give much concentration on that. Initially, they might give, so that is not natural. Until and unless a patient has got some other abnormality which can cause her, pain. I'm not telling about premenstrual syndrome. Regarding the pain, there are many few factors which can cause menstrual pain. Now regarding menstrual hygiene, if I tell you, see, initially, even I think I saw people using in my career of after becoming a doctor, ladies or girls using even cloth or tampons. We even got patients using tampons. But day by day, this have changed, and we have come to menstrual pads. So this is the first idea of a menstrual hygiene. Why shifting from a cloth to a pad? Because pad usually it is sterilized. Number one, changing of pads should be minimum 6 hourly. That is 4 times a day. If a patient have overflow, or a girl, I don't say patient, sorry. If a girl has overflow, then she can change even to 5 times a day. But changing of pads more than 7 is we consider as excessive menstrual flow. Then secondly is your cleaning. Like we usually don't advise using of soap or Dettol during periods. It should be only with clean water or whatever the vaginal wash is available in the market. This keeps a bit of more hygiene during menstruation. Thirdly is even the undergarments should be taken very care of, because few girls, they are shy of washing their panties during this menstruation, and what they do, they wash it and they don't go to the sun. They just try to dry it inside the bathroom or somewhere in the corners. So they should be properly sun-dried. The properly washed and properly sun-dried undergarments, they become sterilized, and it is very good to be used by the girls later. Fourthly, if you consider this hygiene part, at least a bath daily during periods. Sometimes like girls, they might be it's cold season, when it's winters, usually they will not want to take a bath, but during periods it's very good to take a bath daily. That keeps your mind also very cool, your physically also very good. And disposal of pads, here I'm just adding a bit. Disposal of pads should be very, very carefully done, because either the extra sheet can be torn off and it can be flushed, or if somebody disposes, it should be tightly closed in a good packet, and best is dumping inside the mud if it can be done. Because just throwing out the pads, what happens is a dog or a cow, they come across, they try to taste it once, they don't know what is it. And that way we are indirectly causing harm to animals. So nowadays we have come up with, to avoid all these factors, we have to come up with menstrual cups. And menstrual cups are very much available in market, and only thing is very easy to use. Only a bit of explanation is needed. Yeah, anybody comes to us to explain, we do explain. But it's very nicely, even you on YouTube you get, everywhere you get how to use them. And it is very, but yeah, again this sterilization of the menstrual cups is very, very important. Some old people at home might think that how we are coming and suddenly putting in the oven and boiling this one. But that also should be done it privately. Like it should be done giving full explanation to them why we are doing it. So I would always prefer nowadays when present girls should go with menstrual cups.
Ma'am, you were talking about menstrual cramps and pain. So would you like to tell us something about what causes painful or irregular periods, and what is your approach in treating the same?
Maximum girls, they experience pain during menstruation, and this is a very natural, normal phenomenon. I would say that once the endometrial lining deposits, it grows, and this only sheds during periods. Now what happens once there is recoiling of the vessels and the endometrium tries to shed, then prostaglandin is released, and because of this prostaglandin, there is constriction of the musculature wall of the uterus as well as the blood vessels. Once the blood vessels constricts, there is less flow to the endometrium. Now this endometrium then dies off because of less blood circulation, and they shed off. And because of the contraction in the uterus, there can be pain. Now this particular collection of the menstrual blood, when it comes out through the canal, sometimes the canal might be too small. It might, so there might be pain during passage. Sometimes there may be even abnormality in the uterus, that is congenital anemia in the uterus. like we have got septate uterus, we have got unicondylar uterus, we have got bicondylar uterus. Unicondylar uterus also is very painful menstruation. So there we try to find out if the girl has any other causes of development anomaly for the pain. Again, there are two main diseases in the girls which we usually get some, like once a girl comes to us, we give her the initial treatment. Supposing she fails to respond, then we definitely go in for a sonography to find out what is the congenital anomaly, one is whether she is having endometriosis. Endometriosis is a very painful condition during menstruation. What happens here is the menstrual blood, there are some ectopic sites which have got endometrium, along with the uterus, blood collection in the uterus, the blood collects in the ectopic sites, the blood in the uterus comes out during periods, but the other sites they cannot release the blood, it collects there and thereby it causes excessive pain. PCOD is one of the cause of pain during menstruation. Irregular periods. Irregular periods in puberty. Once I now come to puberty, I'll start from puberty. Nowadays, girls they attain puberty at a very young age. Very young age. Why we say young age? Because nowadays girls they try to know earlier. Their maturity comes earlier. So the sexual year starts, not sexual anymore, the sex hormones they start working early. So a girl can menstruate early. Physically they are very active. Cycling, dancing, running. No girls they stay cool nowadays. So that this can be a factor of early menarche. So in young age, a girl might menstruate for the first time and then again she might stop. She might not menstruate irregular. There, nothing to fear of. We try to explain the mother that this because the girl starts menstruating but the hormone status hasn't started working in her body then. So there can be irregular ovulation. So once there is irregular ovulation, only after the ovulation the periods occur. Right? So in puberty, usually up till the age of say 15, we don't bother much. We try to explain the mother. We try to tell the mother, you be cool. Let time come. This will get spontaneously okay, and it takes 2 years time to become okay. In spite of that, say after 2 years or so, we ask the mother to return and to come back to ask and say, if it's okay, fine. If it's not okay, then we try to investigate and see what can be the causes. Again, irregular periods can be because of some hormonal problem. It can be because of thyroid problem. It can be because of this one. Again, I said congenital anomaly in the uterus. It can be because of some hormone pills intake. It can be because of some even if a girl comes to us, we try to exclude one thing. Taking definitely we ask the patient don't take it otherwise. But as a doctor, I have to ask him. Even in teenagers, unmarried girls, we have to exclude pregnancy because nowadays, like unmarried sex, it's done. So we have to exclude at least if the girl is of that age group. We usually try and exclude even pregnancy. And if it is so, we try to help them because nowadays even after their girl crosses 18 years, even she's scared to tell her parents that she's pregnant. Only with her signature, we can take her and go and get the abortion done.
So ma'am, you mentioned PCOD. How common is PCOD and what is the role of healthy lifestyle in treating PCOD?
Polycystic ovarian disease is a burning topic nowadays. It's very, very common, very, very common. Why common? I'll just tell you. It's really common, and we have been trying to go into the matter deeply, finding the causes. I will just tell you according to age group, and treatment also all age group doesn't need. I will just tell you. The polycystic ovarian disease usually nowadays in girls it's more because of the lifestyle they are adapting to. Earlier days, maximum girls used to be inside home, avoiding junk foods. Understood? Working at home with mother or like helping out. And next is less of rest. So what happened is they usually their physical activity at home was more. And nowadays the girls' lifestyle has been totally different. First is no work at home, even not outside. Only you are going to school, colleges, coming back, office, you go and sit, you come back, no physical activity. Second is mobile. Hours after hours, girls are with mobile. So you are sitting in one place. You are utilizing your brain, might be you're in good work, but you are utilizing your brain, not your physical labor. Third thing is junk foods. All girls, you see nowadays, previously hardly say if there were 62 students in the class, 2-3 to celebrate birthdays or whatever. Nowadays, you see 60 out of 60, 50 are celebrating birthdays. Then you have other parties, you have marriage anniversaries, you have even marriage anniversary. So in 30 days time, I think so, 20 days you are outside going for outside foods. And parties foods, it's more rich, very rich in all oily foods and everything. Even bahar ke jaise, you go for a tuition, while back chalo ek pizza or like momo, whatever. So those junk foods are responsible for this. Thirdly, I told you that activities. So no girls are being allowed. Even I don't allow my daughters to work. So here, what is our duty as a parent? We have to at least tell them to avail any physical activity at least twice in a day. Maybe it's skipping, maybe it's dancing, maybe it's cycling, maybe it's walking, maybe it's running, maybe it's in whatever way. One activity if a girl keeps is good. Now, the food habits. I told you one is junk foods. Second is parents, what they do. My daughter is going to study, my daughter is going to tuitions. So 3 times ekdam acha khana chahiye. The food should be it should be full with, all spicy and all good foods. So this is one thing. So we tell our parents, we usually tell the parents when a girl comes with overweight girl and not even if it's young, we tell from that very age, we ask the mother to restrict her food intake. The food there should be actually titrated, food. Say we have a balanced diet for polycystic. We give a good breakfast in the morning. If the girl cannot stay with rice a day, we usually prefer rice in the morning. Because the girl takes the food and then she moves out, she's whatever. She's going to the college, at least she's walking and all. That gets replaced. But food should be full in the morning. Noon time, it should be very light. Very light. Either I say give a dalia or oats or some fruits or sprouts, whatever. Night, preferably, if you can, we can give her some rotis and along with dals. The girl should be full. She should not be empty stomach. She should not be half stomach. But the only thing, curtail carbohydrate like rice, maida, potato, and fatty foods like oil, ghee, butter, Maggi, ice cream, and chocolates. Now, whenever a girl comes to show us, showing her weight, we can understand like she can have. There are a few more symptoms, not only weight. There can be extra hair growth, there can be acne, then there can be acanthosis nigricans. We say that's blackish discoloration we get. Even if we level the case as polycystic, we usually don't go for sonography until the age of 19 years. Because we know we will get. Once we get, the girl becomes a bit like, she gets tensed. What is happening in me? Might be, if she understands. Mother becomes more, tensed. So that causes more problem in the patient. Only that we have to guide the girl and her mother how to continue the lifestyle further. After the age of 19, we try to explain the girl. 19 to 25, we have to be very strict. We have to see that she has been treated if needed, or if we can change her lifestyle and we can bring back her to a normalcy, that is good. But again, polycystic, we have to tell one is obese PCOS and one is lean PCOS. In obese PCOS, khana band karo, then you put on regular exercise and everything works. But in case of lean PCOS, there we cannot restrict her food much. There we can restrict. So exercise helps. The insulin resistance is there in PCOD. So more of exercise, it brings down, that insulin resistance part is taken care of. And so the PCO might come down. Thirdly is regarding your, 25. Till 19 to 25 I said, yes, we take care of, because after 25, we know a girl can get married anytime, any moment. So if we treat her early, at least after marriage, she doesn't face problem of, because one of the commonest cause of infertility is PCO. So we take it to our ear that we see that the girl at least doesn't suffer from that, at least that mental trauma later on. And our explanation is that way, that you take care, we are there for you.
Right, ma'am. Ma'am, so what is the right time to have a child, and does a woman in her, say, early or even late 30s face any kind of issues or any kind of difficulty in having a child at that age?
This time, I would say, according to me, it's after the age of 25. I don't advise any of the girls. I tell them, don't get married before 25 at least. Enjoy your life first. Is you have got liberty at your home. See that you are in your mama's lap at least till 25 years. Because till 25, we consider a girl to be a kid only. I thought to consider. So after the age of 25, yeah, you are free to get married. Then, if you say later, it can be seen. Now, this age differs on your career. According to your own will. Nobody can force you to get married. I cannot say you have to. So it is the will of the girl when she should get married. She should choose her own age. Secondly, I said it is according to this one.
Career.
Career. If you are still left with career, yeah, you can wait for some time. 30, I won't. 30 is okay, but 30, I won't say it's a factor. You can get married. And above 30, see, you can wait. But nowadays there are actually, since we have got many ways of getting a girl pregnant, because આજકાલ infertility centers and they have got many ways. Like an infertility specialist can help you, even if you fail also. There are many ways. Even see now, supposing you want to get married at the age of 30, say 39, what you can do is, even you can preserve your follicle, your own egg, and you can keep as that is known as cryopreservation. You just preserve your egg in an infertility center, and only thing that you have to, the cost is taken every year, that is okay. And when you finish everything and you think, yes, I am now fit to get married, you get married, and you can, even if you don't have your own eggs, then you can utilize that stored egg to get pregnant. But through an IVF, because then you can have a natural pregnancy. It should be with IVF. So that is where there is no age barrier. Like we don't force anyone. It's okay, but still, then if you say as good age, it's best from 25 to 30 years.
Right, ma'am. So, ma'am, talking about women who are sexually active at a young age, do you suggest them to be on daily contraceptives, and do they have any side effects?
So, young age, yeah, that is a very good question. Now, young age oral contraceptive pills, there are many pills in the market, and low dose pills are very good. But young girls, I would say one thing I would say you very initially, that is oral contraceptive pills will not save you from sexually transmitted disease. You might not get pregnant, you might be safe in that way. So choosing a partner is very, very important. Once a girl at a very young age chooses a partner, she should be very clear, even the boy should be clear, about the girl, and the girl should be clear about the boy, that none of them bears any sort of diseases. And sexually transmitted disease, once attained is attained. Treatments are there, but still there. Now, you don't know, because you are saying about young age, suddenly they might break off. So, and the girl goes to another partner, there might be a problem. Recently, I had a patient. The husband is in army. They both of them come to me. When I tested, the girl was syphilitic, the husband was not normal. I tried to explain him, I could not say that, but I tried to explain, but she gave me a correct history. When I called her alone, I asked her, she told me that she had a relation with the boy before, but ultimately they broke up and then she got married. Now I'm treating her for syphilis, and then I said after her treatment finishes, then I'll see into the infertility, because they are infertile for 4 years. So this is one factor. Oral contraceptive pills might give prevention, but you have to be very careful regarding this. Now, oral contraceptive pills, when we give, we prefer low dose pills. Why low dose pills? Low dose pills have got lesser of side effects than the normal way, which are going the market. A girl just cannot go and buy a oral contraceptive pills from the market, because the pharmacists, they have got this idea, they'll give any pills to you. They won't consider age, they will not consider anything, and they'll just give it. So low dose pills in the market which are available are very good. But any contraceptive pills, we don't usually give more than 2 years, because in the long run, this oral contraceptive pills might have some problem, can create problem. And it is said that oral contraceptive pills taken for a long time, sometimes even the blood clots are formed. And this can go to the brain, it can go to the lungs, it can go to the veins also, causing deep vein thrombosis, it can cause pulmonary embolism, it can cause stroke also. So long time uses of this one, OC pills is not good.
Ma'am, the model of the uterus on your table is encouraging me to ask you about uterine fibroids, ma'am.
Yeah.
So, tell me about the prevention of uterine fibroids and if we can do something to prevent uterine fibroids.
Yeah. Uterine fibroids, if we consider around 50 to 60 percent of women have got uterine fibroids in them. Some are diagnosed, some are left undiagnosed. But since it's a benign tumor, 90% are benign tumors. So since they are benign tumors, they don't cause much problems. Yeah, the earlier we get, there is treatment. So there's nothing as such which you are asking me prevention. You cannot prevent. But why a uterine fibroid occurs is because of the increase in the progesterone in the estrogen receptors in the uterine lining. The fibroid occurs from a muscle cell, definitely. But there are plenty of these receptors in the particular area. This causes faster growth of the fibroid. But all fibroids are not fast growing. Some they really stay benign. They don't cause any problem. And maximum are benign. Very few in the later age, say a lady having a myoma after the age of 45 or so can land up having a calcified myoma, can land up having, and very rarely it goes to uterine sarcoma, but this is very, very rare because nowadays sonographies are so oftenly done. Usually we don't miss a myoma, and myoma less than 2 centimeters is very harmless. Positioning of the myomas matter a lot. Which area? There are, according to Foucault classification, we have 8 types of positional myomas which we classify. So the treatment depends on them. Treatment depends on the size. When the size goes above 2 centimeters, yes, there are medicines nowadays. Medicines are available for uterine myoma, and we try to keep them reduced until a lady gets married or gets pregnant. Again, myoma is not the cause of infertility until and unless it is fibro stage 0 or 1 or 2, say. Because usually, so when we get a myoma, we try to localize which areas it is. If it is safe, we ask the mother to get pregnant, a lady to get pregnant, and during delivery, if possible, we remove the myoma at the same go. If the lady gives us consent, but usually they do. So that way we get, if it is a cesarean, if it is a normal delivery, again, pregnancy may first 3 months the myoma increases in size. After that, the baby takes the upper hand, the myoma becomes dominant, and the myoma size usually doesn't increase. So there also, it is a good that pregnancy can have a certain effect on controlling the size of the myoma.
And my last question to you is, how important do you think is awareness regarding the female body, and how frequently should a girl get regular checkups, and at what age should she start?
Awareness, nowadays we are very much bent down to awareness because we, from Foxy itself, we are going from school to school and giving awareness regarding menstrual hygiene. Second is about menstruation, irregular menstruation, PCOD, and next is self-defense. It's very, very important, self-defense nowadays. So, regarding awareness, what we try to aware the girls even from 5th, 6th standard. I last I went to 3 schools. I asked us from class 6 standards to be with us. Initially they were shy, but later on I told them, yes, you are supposed to know this, and once you know, you can again go and tell another 5, and this way we girls can be safe enough. So that is what awareness is very, very important nowadays. You as a mother, we have the right to make our daughter aware at the least possible age when we become close with our daughter. I did it at the age of 10 years, before my daughter got her periods. Okay, so secondly, that I told you about self-defense. We even say, maybe it is your uncle, maybe it is your brother, whoever it is. Touch, whenever somebody touches on your body, you should understand what type of touch it is. If you don't like the touch, just scream out and say no or na. This is enough for somebody to understand a female voice saying no or na. That means she is protesting. So somebody will come to your help. School, you have any problem, your teacher is your best friend. At home, you have any problem, your mother is your best friend. And nowadays we see, be it menstruation, be it whatever, nothing shame. You should not be shameful of anything. Even if a girl gets a period, she can very well sit near everyone and she can say, I'm menstruating. This is a physiological process. It is nothing to hide with. Might be girls might think we are hiding, but a boy sitting here, he knows a girl's menstruates. So what is there in hiding? So there is no shame to it. Rather, somebody can help you. If you are in problem, suddenly you menstruate with somebody, you can take help of somebody else. At least get me a packet of pad. I need it. So there, nothing to get shy of. So you can, it depends actually. Some mothers are very shy. They will not say near their parents. I mean near the kids. So we try to educate more of the mothers than the child. So awareness, I would say, is very, very important now. It's very, very important.
And regular checkups.
Regular checkups, until a girl have any problem till the age of say 19-20, we usually don't ask. But nowadays girls are also very, very alert. Slightest problem, they try to come to a doctor. Only when at least she tries to understand 16 plus. Every girl try to understand themselves now. Discover, you have got internet with you. You have got everything on YouTube. You have got everything on Google. So everybody tries to find out. So my slightest problem, they try to see what is happening in me, and they try to come. So if a girl needs a checkup after that, if a girl can come to a doctor at least once yearly, it's good. If she has got some problem. If she doesn't have, by the by, at least 2 yearly periods according to her necessity, she can definitely come. There's no harm.
Thank you so much, ma'am. It was wonderful talking to you. We hope to have many such conversations with you. Thank you so much.
Thank you so much. I'm privileged to have you all here with me today. At least I could share with you some of my knowledge, and I think so it will be of use to the society. Thank you so much.